Hi, I'm Nolan Allaer, and this is my ARP video. My question is, how can virtual and augmented reality aid in surgery and surgical education? So here I am with my virtual headset. This is the Oculus Rift, hooked up through this cable to a PC. So I'm using the virtualing software. So this is usually a standalone headset, so it runs on its own software. It doesn't need a PC. But for the surgery I'm going to be running, or the simulation I'm going to be running, I need to hook up to a PC. So, but I have the capability of doing that. So now, go into VR, and this is the Steam VR homepage, so I can pretty much see all the things I have installed. That's just the Oculus page. So we are going to do, in the homepage, click on this, this Wraith knee surgery, which I was able to download online. Let's boot up it. Let's boot it up now. There we go. So as you can see, I can see my hands, every movement. Here we go.
Welcome to Wraith, Virtual Medical Training Simulator. In this simulation we will be performing a total knee replacement surgery. Grasp the patient's left ankle, preferably with your left hand.
I'm going to try and reset where I'm standing real quick. Back a little bit, 1 second. Reset the view. Okay. So here we are. Grasp the ankle.
Good. Now manipulate the leg to reposition the knee into 90 degrees of flexion. Select the scalpel from the Mayo stand to your left.
Okay, so this, actually, if you're able to see this, this is my guardian. I'm not able to pass this. This means I'm getting close to something in the real world that I might be able to hit.
Good. You will see a linear highlight on the knee. Good. You will see a linear highlight on the knee showing the optimal path for the skin incision. Use the scalpel to make the incision starting just above the patella. Extending out, you may probe the margins of the incision with your finger. When you are ready, use the retractor on the Mayo stand to expose the fascia surrounding the joint capsule. Select the scalpel from the Mayo stand to your left. Now make an incision in the fascia. Use the highlight as a guide. This incision begins just above and medial to the patella, continues around and proximal to the medial patella, and extends along the medial edge of the patella ligament, to the insertion at the tibial tuberosity. Grasp the patient's left ankle, preferably with your left hand.
Yeah, so I'll take a second to kind of showcase what's going on. So he's giving me advice in the headset, as you can hear, and it's kind of just walking me through what's going on. So someone, a medical professional, could go through this surgery, 10, 20, 100 times until they get the procedure down. Obviously, I'm not a medical professional. I don't know what I'm doing. So this is helping me understand how to go through this surgery without any sort of experience. So for someone who understands what's going on here, that would make a really big difference. And although it's not actually them doing it, it's just kind of going through the steps and getting an idea.
Perfect. Now move the ankle to position the knee into full extension. Grasp the lateral margin of the full incision, preferably with your right hand. Pull the incision. You must grasp and hold the lateral patella dislocation to continue. Good. Now manipulate the leg to reposition the knee into 90 degrees of flexion.
Right there.
The first pin is installed 4 finger widths below the incision site. Grab the pin driver. For the simulation, the pin driver will have the necessary pin already loaded on the pin driver. Pull trigger to install the anchor pin and secure the tibial array to the anterior tibial cortex.
Okay, here we go. Over here, actually, I can even jump to this side of the table, turn around, and do it here. So I'll use my hand, actually.
Select the tibial target array already mounted to the universal 2-pin fixation block. Place it over the anchor pin you previously installed on the tibia. Grab the pin driver.
Oh, gotta go grab that. Where is that? There it is.
Pull trigger to install the anchor pin and secure the tibial array to the anterior tibial cortex. Now select the femoral target array already mounted to the I-block femoral cutting guide robot fixation place along the medial aspect of the distal femur. The fixation base clamp will help find the proper anchor placement. 2 anchor pins are required to anchor the fixation base. Grab the pin driver. Pull trigger to install the first anchor pin, securing the femoral array to the medial cortex of the distal femur. Pull trigger to install the second anchor pin. Select the nanoblock. The nanoblock will guide the tibial resection. Position the nanoblock over the tibial tuberosity. The target array assists in placement. 3 anchor pins are required to anchor the nanoblock. Grab the pin driver. Grab the bone saw to resect the tibial plateau. Place the blade into the resection guide on the nanoblock to resect the tibial plateau. The nanoblock can now be removed. Grab the pin driver to remove the anchor pins from the nanoblock. Remove first anchor pin. Remove the second anchor pin. Remove the final anchor pin. Grab the nanoblock.
I'm going to turn around here so you can see kind of what's going on. Go over here. Change the angle a little bit better. Okay.
Return it to the Mayo stand. Select the balance bot. Install by inserting the robotic paddles into the joint space on the resected tibia. Grasp the ankle and manipulate the leg into full extension and maneuver the leg through a complete range of motion to get quantitative data on the knee. When complete data acquisition is achieved, return the knee to 90 degrees of flexion on the surgical table.
He's flexible. All right.
Grab the balance bot. Return it to the Mayo stand. Grab the I-block. The I-block guides the femoral resection. Attach the I-block to the femoral fixation base near the femoral target array. Observe the I-block automatically adjust to create the distal cut. Grab the bone saw. Place the blade into the resection guide to make the distal cut. The I-block will now adjust trajectory. Now use the bone saw to make the anterior cut. Allow the I-block to adjust trajectory. Now make the posterior cut. The I-block is now ready for the anterior chamfer cut.
That's cool. It keeps the saw in a certain position so you can make a clean cut.
You may now make the final posterior chamfer cut to complete the femoral resection. Grab the I-block and return it to the Mayo stand. Grab the tibial impactor and mallet from the Mayo stand. Hold the tibial impactor in place. Now strike the impactor strike pad with the mallet to impact the tibial tray into the tibial plateau. Grab the I-block and return it to the Mayo stand. Grab the tibial impactor and mallet from the Mayo stand. Hold the tibial impactor in place. Now strike the impactor strike pad with the mallet to impact the tibial tray into the tibial plateau. Now strike the impactor strike pad with the mallet to impact the tibial tray into the tibial plateau.
So you can see there's just some slight glitches like you did. Obviously, it's not like real life, so I mean, you have to kind of figure it out as you go. So let's try and switch hands. Am I angling this right? Down. Try and figure this out together.
Pick up the femoral shell.
There we go. I guess that works. I guess we kind of found a bug in this simulation.
Approximately place the femoral shell onto the prepared distal femur.
That I downloaded online.
Grab the femoral impactor and mallet from the Mayo stand. Place the impactor on the femoral shell and hold in place. Now strike the impactor strike pad with the mallet to seat the femoral shell on the prepared distal femur. Select the poly inlay.
Oh, well. That one wasn't really, didn't have a problem. That one.
Insert the poly inlay into the tibial base. Now run the final range of motion test.
Cool. Let me close up.
Congratulations, you have earned the total knee badge.
Alright, so with this, there are more simulations you can do through that. Oh.
Medical training simulator. In this simulation, we will be performing a total
Starting up again.
surgery. Grasp the patient's left.
Quit that. Okay. So with that surgery and with that simulation, you can do more than just the knee surgery, but it is paid content. So I figured I'd walk through just the simplest kind of design. But I mean, it is really incredible what you can do through VR just by downloading a simulation. Like that was like a really, the first time I did that, it was really incredible, and it's a shame that I wasn't able to allow people to do that themselves, because it is a truly like incredible experience the first time in VR and doing something like that. But I hope you learned a little bit about why I feel virtual reality is very important in the future of medicine and surgical education, and how viable it is to replace traditional forms of training on dummies or surgical procedures on cadavers and other such traditional practices. But thank you for stopping in, and bye.